guys, so today I'm going to go through the axial muscles, starting with the muscles of facial expression. So instead of going through a PowerPoint, I'm just going to go through these tables that I made along with the app. So your axial muscles, they have both of their attachments on the axial skeleton, and they're going to support and move the head and the spinal column, affect your facial features. They're going to move your mandible during chewing, assist in food processing and swallowing, aid in breathing, and support and protect your abdominal and pelvic organs. So starting off with your muscles of facial expression over here, we're just going to go right into it. So our first muscle is the frontal belly of the occipitofrontalis. And so here you can see it originates up here in what's called the epicranial aponeurosis and inserts just on the skin of your eyebrows and just about the root of your nose. So when this muscle contracts going from the insertion to the origin more superiorly, it's going to allow you to raise your eyebrows and wrinkle the skin of your forehead there. So here's your frontalis muscle. Yeah. All right. So our next muscle then is the buccinator, the buccinator muscle here. And so this one, it originates back here, kind of on the alveolar processes, remember, of the mandible and the maxilla, and then it's going to insert right on the angle of your mouth. So what the buccinator muscle does is going from I to O, you can kind of imagine it's going to compress your cheek. So when you're chewing, and you need to keep your bolus of food in between your cheek and your teeth, that's all thanks to the buccinator muscle. Also, brass instrument players, they frequently use that when they're blowing into their trumpet or trombone or whatever. So that's the buccinator muscle right there. Get a good view of that. All right, so the next muscle then is going to be depressor anguli oris, and you do have one on each side. Here's the left and the right. And so as you can see, these ones originate down here inferiorly, and they insert right into the corners of your mouth inferiorly. And so going from I to O, imagine having a rope. It's going to pull the corners of your mouth down, and it's going to be allowing you to frown. Just like that. So that's going to be your depressor anguli oris. And then close to that, literally right next to it, is going to be your depressor labii inferioris. You have a left and a right again. And so this one, it's going to be inserting right into your lower lip, and it originates down here on your mandible. And so that one, just imagine a rope pulling from I to O. It's going to depress your lower lip here. And so superiorly, we have literally the same thing. So starting with, So starting with your levator anguli oris, it's going to originate on your maxilla up here, and it's going to insert right into the angle of your mouth. So if you can imagine a rope pulling, that one's going to pull the corners of your mouth superiorly and laterally. So that's your levator anguli oris, similar to the depressor anguli oris. And then this one right here is going to be your levator labii superioris. So this one's going to originate superiorly and then insert right into your upper lip. And so just like the depressor labii inferioris, levator labii superioris is going to pull your upper lip up. So if you can imagine that Elvis sneer, like that, kind of, maybe, that's going to be all thanks to that levator labii superioris there. And again, you do have one on each side. All right, so then the next muscle on our list is orbicularis oris. And so this muscle has circular fibers, right? It's a sphincter muscle. And so this one's going to allow you to close your mouth and pucker your lips. So that's your orbicularis oris muscle there. The next one on the list is zygomaticus major. Here's zygomaticus major. It's lateral to zygomaticus minor. And so both of these are going to be originating on your zygomatic bone. Remember your cheekbones, and they're both going to be inserting right into the angle of the mouth. So imagine a rope going from the angle of the mouth to the zygomatic bone. It's again going to be your smile muscle. So they're going to be able to also elevate the corners of your mouth, just as going from I to O would show you. All right, so then we get to orbicularis oculi. Here's orbicularis oculi there. And so your eyes would be obviously right in here in your orbits. And so those are going to allow you to close your eyes, to wink, anything like that. So it's another circular fibered sphincter muscle, just like orbicularis oris on the mouth. And then our last muscle of facial expression is going to be, the platysma. So here's the platysma on the right. And then here's your left platysma there. So with these, this is going to allow you to tense the skin of your neck. So just doing that, and it will also in the process pull your mandible down a little bit and your lower lip also. So it's going to be inserting up here, originating inferiorly down here. So going from I to O, you can imagine it and you can feel it as well. And you flex your own platysma there. Right, so now moving on, to the muscles of mastication. We went over 4. I've hidden some other muscles just to make it more clear what we're looking at. So starting off with the temporalis muscle. So it's going to originate up here, all in this temporal fossa, and then it's going to originate right on your mandible anteriorly over here, or on the lateral aspect, but on the more anterior process, the coronoid process. And so when you can imagine, I can show you actually. So going from I to O, we're going to get elevation of the mandible, right? So when this temporalis contracts, you get mandible elevation, and then you will also get retraction, right? Because those fibers are pointing a little bit posteriorly. So you can see going from I to O, the mandible is going to retract, and then it's also going to pull it up. So mandible elevation as well. And then our next masticatory muscle besides the temporalis is actually, I'm just going to show you it on this side. So as you can see, this one, it is superficial to your mandible, the masseter muscle, and you have a superficial part and then this deeper part right here. So for your masseter, it's going to originate on your zygomatic arch over here. This one more closely on your zygomatic bone, and then it's going to insert right on the inferior lateral part of your mandible. So when this muscle contracts going from I to O, again, you're going to get elevation of the mandible. And then the masseter also does some mandible protraction as well, going from I to O. All right, so then our next muscle, we have the 2 pterygoids. So I'm actually going to fade the mandible here. So we're going to start with the medial pterygoid here. Here is the medial pterygoid, and then this other part as well. Just too hard to select it. So your medial pterygoid, as you can see, it's going to originate up over here on your sphenoid bone, and then it's going to insert onto your mandible here. So going from I to O, it's going to allow you to get these side-to-side movements of the mandible. And then it will also assist in mandible elevation, right? Going from I to O, you can imagine like a rope. It's going to allow you to elevate your mandible. And then lastly, it also allows you to protract your mandible, which I believe, yeah, you can see that here. So the muscle's covered up, but here's the mandible contraction, right? Going from I to O. Okay. So that was your medial pterygoid. So it's going to be elevation, protraction, and that side-to-side movement. And then finally, we get into our lateral pterygoid muscle here. Here's one part, the other part's just right up there. And so your lateral pterygoid, it's also going to be originating on the sphenoid bone, and then it's going to insert onto the neck of the mandible here. So going from I to O, you're going to get protraction, right? Which you can imagine you're pulling from here to here. You get protraction of the mandible. And then you're also going to get, again, that side-to-side movement. which I believe here it is. Yep. So it's going to be that lateral side to side movement. You can see that there. But what's special about the lateral pterygoid is that, as you can see, it's also doing depression of the mandible. So going from I to O, depression. Only the lateral pterygoid aids in depression of the mandible out of the masticatory muscles. So lateral, depression, medial, elevation, as well as the masseter and the temporalis. All right, so now moving on to the muscles that move the tongue. We went over 3, and so clearly I've moved some things around. I've gotten rid of some bones. So, here's your frontal, here's the sphenoid, and right here's your ethmoid bone. And then this bone inferiorly is the hyoid. Here's your temporal bone, zygomatic, just so you have a bit of an idea what we're looking at. All right, so the 3 muscles that move the tongue, starting with right here, it's your genioglossus muscle, right? You have 2, one on the right and one on the left here. So the genioglossus, it's going to originate on the anterior mandible and then inserts right into the body of the hyoid bone and then also right into the tongue there. You can see that clearly right here. So going from I to O, if you can imagine pulling a rope, that's going to allow you to protract your tongue. So I always say if a genie comes out, you're going to stick your tongue at him. So that's genioglossus. And then our next one, we can look at the styloglossus here. So styloglossus, it's going to originate on, remember that styloid process of the temporal bone? Styloglossus originates right there on that styloid process. And then again, it's going to insert right into your intrinsic muscles of your tongue. And so going from I to O, imagine not only is it going to be retracting your tongue, so pulling it back, but it's also going to allow you to elevate your tongue. So as you can see that the origination is superior to the insertion. So if you're lifting up your tongue, think your styloglossus muscle. And so a way to remember that the styloglossus retracts the tongue is, it's not stylish to have your tongue out, so you're going to retract it. And then our third muscle is going to be the hyoglossus muscle. So the hyoglossus originates inferiorly on the hyoid bone. And then again, it's going to insert right into those intrinsic tongue muscles. So going from I to O, let me zoom out a little bit. You can imagine having a rope. It's going to not only retract your tongue, but it's also going to depress it, right? Because as you can see, these fibers go inferiorly towards your hyoid bone. So it's going to depress your tongue and retract it as well. So those are your 3 tongue muscles that you need to know. All right, so now moving on to the muscles that move the head and the neck. There's 2 that we went over. So starting with the sternocleidomastoid. So that's going to originate, as its name implies, on the manubrium of the sternum. So that's the sternal part. And then also the medial aspect of the clavicle. So that's going to be the cleido part. And then the mastoid part, it's because it's going to insert right on that mastoid process. Remember, just posterior to your earlobe of your temporal bone here. So this and this are both your sternocleidomastoid muscle on the right. So you have one on the right, and then you have one on the left as well. So when the one on the right unilaterally contracts, you're just going to get lateral flexion. So here's my right sternocleidomastoid muscle. And so if I just imagine pulling, going from I to O, just imagine you're going to get lateral flexion of the head to the same side that the muscle's on. So here's the right sternocleidomastoid muscle contracting, and this skull is flexing to the right side. Now, also, when you do a unilateral contraction of the sternocleidomastoid muscle, you're going to get contralateral rotation of the head. So that means rotation of the head to the opposite side. So again, imagine I have a rope going from my mastoid process down to my manubrium of my sternum and to my medial clavicle here. So if I pull that rope, it's going to rotate my head to the left, so the opposite side that the muscle's on, which you can see clearly here as well. So remember, here is the right sternocleidomastoid muscle, both of these parts. And so since it's unilaterally contracting, it's pulling this person's head to the left. But when we get a bilateral contraction, so when both sternocleidomastoid muscles on either side are contracting, then you're just gonna get flexion of the head at the neck anteriorly. So both of them are contracting. Imagine that pull, and you can literally feel it. So that's your sternocleidomastoid muscle. And then I'm just gonna hide the sternocleidomastoid because just deep to the sternocleidomastoid are going to be your scalene muscles. So here are your right scalene muscles, and then again they would be just deep to your left sternocleidomastoid over here. So your scalene muscles here, as you can see, they're going to originate on your transverse processes of your cervical vertebrae up here, and then they're going to insert onto your first rib, or your ribs in general. So going from I to O, you can see if we have a unilateral contraction, it's going to just pull it to the same side. So you're going to get lateral flexion of the head at the neck. But if we do a bilateral contraction, so we're flexing both our left and our right scalene muscles, again, you're going to get a anterior flexion of the head at the neck. So. Right, so now moving on to the muscles of the vertebral column, we talked about two different muscles, one being a muscle group. So first, the erector spinae muscles. Here are your erector spinae muscles on the left, and then here they are on the right. So your erector spinae muscles consist of three different muscles. So going from lateral to medial, we have first the iliocostalis, and then we get to the longissimus, and that's the middle muscle of the group. And then finally, right on the spine, here are your thoracic vertebrae, is your spinalis muscle here. So you can remember the acronym ILS to remember from lateral to medial, and just knowing that spinalis is pretty much right on your spine. So what to know about the insertions and the origins is that for your erector spinae muscles, they're all going to originate inferiorly near your iliac crest of your, remember your os coxae, and then they're all going to insert superiorly somewhere, either on spinous processes, parts of ribs. So the I like to say I is high for the erector spinae. And so what that means is going from I up here to O inferiorly. If you can imagine a rope, that's going to extend your spine, okay? And I'll show you that here. So that's not those muscles contracting. When we get the extension now, here all of your iliocostalis muscles are going to allow this extension of the spine, in this case hyperextension there, right? Because going from I to O, we're going to be pulling I to O, pulling that spine back. But we can also have a unilateral contraction. So if not both sides are contracting, and then we'll get lateral spine flexion to the same side. So if we only have, for example, the left iliocostalis contracting, it's going to flex your spine. You can't see me doing it, but I am. It's going to flex your spine to the left, just as you can see here. Okay, so those are your erector spinae muscles, keeping the spine erect and extended. And so I'm going to hide those so we can see our next muscle, right here, quadratus lumborum. So here originates on your iliac crest. And then again, it's gonna insert superiorly, as you can see on the ribs, transverse processes of your lumbar vertebrae. So imagine going again from I to O. It's gonna extend your spine, which they don't have that in here. They only have the unilateral contraction. So if both of your quadratus lumborum muscles contract, again, going from I to O, you're going to extend your spine. But if you only have one, so you have a unilateral contraction, it's just going to flex your spine to that same side again. All right, so now moving on to the muscles of respiration, we looked at 3. So you have your intercostals and then this big dome-shaped diaphragm here inferior. So starting with the intercostals, here are your external intercostals again. And so your external intercostals, what they're going to do is when you're inhaling air, those are going to elevate your ribs during inhalation. So I like to think EE, external, elevates ribs. So that's what those are going to do. So when you take a deep breath, you can feel your ribs elevating and you can think your external intercostals. And so if I just hide those, deep to the external intercostal muscles is your internal intercostal muscles. So your internal intercostal muscles only contract during forced exhalation. So what they're going to do is depress the ribs only during a forced exhalation though. So just breathing normally, inhaling air, elevation of the ribs by the external intercostals. Now I'm exhaling gently. There's not going to be a contraction of the internal intercostals. Only during forced exhalation will these muscles contract. And so now looking at the diaphragm, I was upset that there was no motion in this app for the diaphragm, because what the diaphragm is going to do is when you're inhaling air, you need to have more space, right? You need to have a lower volume to get more air to come in. So your diaphragm is going to actually flatten out and make more space. And then when you're exhaling air, your diaphragm will move back up, get back into its dome shape, decrease the volume of the thoracic cavity, and push that air out. So I got this little video. It's a short video. You can see that. So when you are inhaling, the diaphragm's moving down, and now exhaling, the diaphragm's moving back up. Inhaling, you can see the ribs elevating, diaphragm moving down. Exhaling, ribs are going back to normal, diaphragm's getting back into that dome shape. So that's how your muscles of breathing work. So now moving on to our muscles of the abdominal wall, we looked at 4. And so bilaterally, when all of these are contracting, you're going to get flexion of the trunk crunches, doing sit-ups. Those are all going to be your abdominal muscles. So we're first going to look at the external oblique. So the external oblique's fibers are directed inferomedially. So what that means is that it's going to originate superiorly and a little bit posteriorly over here, as well as laterally, a lot laterally. And then it's going to insert inferiorly on your ASIS, okay? So then going from I to O, it's similar to the sternocleidomastoid. It's going to actually rotate your body to the opposite side. So if I'm imagining pulling a rope from my ASIS up posteriorly and laterally, you can imagine that, and I'll show you that as well. So we're contracting the right external oblique, and as you can see, the trunk is rotating to the opposite side. It's rotating to the left, right? Going from I to O, these muscles are pulling, and we're pulling the trunk to the opposite direction there. And now this is to be contrasted with the internal oblique, which I just hid the external oblique over here on the left. And so in this case, the fibers are directed superomedially. So what that means is that this time, instead of inserting on your os coxae, it's actually going to originate there, and it's going to insert more superiorly and laterally and posteriorly here. So now if we imagine going from I to O, that's going to be pulling your trunk towards the same direction, right? So if I contract my right internal oblique, it's going to rotate the body to the right side. And I'll show you that here. So contraction here of the left internal oblique, and we're getting a same side contraction, same side rotation to the left. I'll just show that one more time. Okay. And so for both of the obliques, though, another unilateral action would just be lateral trunk flexion to the same side. And then bilaterally, if both of your obliques on both sides contract, again, you're going to get anterior spine flexion. So now moving on from the obliques, let me just hide, that one there. Now we get into our transversus abdominis. And so you can see these fibers are straight, right? So these ones are going to be originating on your 7th to 12th ribs on their costal cartilages. And then they're going to be inserting onto this pubic crest down here, so anteriorly. So here's where they originate. And then here's where they insert. So going from I to O, you're going to get flexion of the vertebral column. So let me show that. If we just have a unilateral contraction, flexion to the same side. And then again, a bilateral contraction would be anterior spine flexion, or trunk flexion. And then our last abdominal muscle is just the rectus abdominal. And so this one, it's just straight up going to flex your trunk. So pulling you this way. Okay. And so remember, if all of your abdominal muscles contract, any bilateral contraction will also flex your trunk in the same way here. They also all compress the abdominal wall. Okay, so our last axial muscles are going to be those of the pelvic floor. So there's two that we looked at. First of all, the coccygeus here, that's the more posterior muscle, right and the left. And so the coccygeus, all you really need to know is that it's going to support your pelvic viscera and help form the pelvic floor. You can see that posteriorly. And then we get into the levator ani muscle. So the levator ani muscle itself is composed of the iliococcygeus, the pubococcygeus, and the puboanalis or the puborectalis. So here's the levator ani. I'll select it again. And so the levator ani, same thing. It's just going to form your pelvic floor here. It forms the majority of it there. And it's going to support your pelvic viscera again. But also one thing to note is that it's going to have to relax in order for you to defecate. So yeah, that's pretty much all you need to know about the muscles of the pelvic floor. And then also remember you have that external anal sphincter. Just similar to any other sphincter, it's going to have to relax in order to allow you to defecate again. So I hope that helped with the axial muscles. Have a good day.